Hello, everyone, and welcome to yet another Caregiving Gen X Style. I am Steve Mullen.
And I'm Jennifer Mullen.
It's no secret, and it's something we've talked about a number of times in this podcast. Assisted living facilities are insanely expensive.
Very.
On this episode, we will talk with a social worker who will provide some tips on things you can do to offset the cost. But first, Jennifer, how's your mom?
My mom's doing great.
Great.
She really is. Things are going along very nicely. A mom adjacent story is related to a text exchange my brother and I were having today. So, of course, open enrollment just passed, and we decided to switch my mom's healthcare insurance. And it's been...
This is the Medicaid provided insurance.
Right. Well, yeah. So she's a dual enrollee. She has Medicare and Medicaid. It's a dual enrollee plan through the same insurance company. It's going to streamline things quite a bit. But it has been very confusing, I think, just based on the timing and when certain doctor's visits happened and some very specific expensive medication that she's on. And my brother sent me a long text just a little while ago about a 2-hour call he had with the health insurance company yesterday. And then I was filling him in on a conversation that I had a few weeks ago that I didn't fill him in on because actually he was out of town and I was trying not to bother him. I was just trying to take care of some things. But I guess really all I'm trying to say is, yet again, and I think we've probably mentioned this before, I do not know what elderly people who do not have, and this is not meant to be like me patting myself on the back or Steve, patting you on the back or my brother on the back.
I do like pats on the back.
I know you do. Yeah. But seriously, I don't know how some elderly people navigate all of this.
I don't either.
My brother and I spent hours on the phone getting everything straightened out and plans aligned and talking with different people here, there, and everywhere at the health insurance company and doctor's offices and the pharmacy, to get deliveries set up. It is complicated. It's so complicated. And I am reminded of hopefully my mom is reminded how fortunate she is that she has us to help her get through all this. Because, man, I don't know what she would do if it was not. And again, truly, I don't mean this as a pat on the back, but you know what?
Take the pats on the back if you can get them.
My heart, I guess what it comes down to is my heart really does go out to people who don't have maybe the level of support that they need to navigate through some of this. And I would imagine that some of it is people saying, yep, that sounds good. And then they just kind of hope for the best. And, insurance covers what they needed to cover. And, they move on.
Yeah.
So anyway, so that was just a mom adjacent story. But Steve, how's your mom?
She's doing great. Little story that came up. We keep track of some little funny how's your mom things in a note on our phones. But one of those that I've been saving for a later day came up with my mother, so I thought I'd talk about it. So you'll recall, or longtime listeners will recall, I've got her apartment set up with an Alexa, and it can be used to turn her lights on and off. Because she's in a wheelchair, it would be a lot harder for her to go around and turn off all the lights. And really, once she's in bed for the night, she can't get out without help, so she wouldn't be able to turn the lights off if she can't reach them. So, there's been some trouble with this over the years. She sometimes forgets the name of the thing. It was Alexa, then we changed it to Amazon, which weirdly she can remember that, but not Alexa. I don't know why. But there was a problem for a while. And I will say, this was actually something that I did sort of wrong. But
what? I'm sorry, can I take note of that?
Yes,
you just admitted you were wrong.
I admitted to doing something wrong. When I set her up with Alexa, I, of course, logged her in on our account. And one of the benefits there is I could turn her lights on and off from my phone while we're at home, which is a nice little benefit.
Yes, but also
there were some, I guess, crossed wires somewhere where she was turning our lights on and off at our house because we have several smart lights, smart bulbs, whatever, around the house. And, we'd wake up at 5 o'clock in the morning and our bedroom lights on. Or the downstairs lights on.
Or Jackson's bedroom lights on.
Up in I have a third floor man cave. She would turn that one on, off and on all the time. And I don't know exactly what she was doing to do it because you can go back and look on Alexa on the app at the commands it's been given. And she wasn't necessarily doing anything wrong. The only thing I could think of, she was mumbling or something.
Yeah.
And I do know there were some times where she would say, Alexa, turn on the lights. And it would say, which lights would you want to turn on? I don't know, all of them. And then boom.
Which all of our lights
everything is lit up. So
we might have talked about this on the technology episode, but it's funny enough. It's definitely worth mentioning again if we had.
But I mean, we'd just be sitting there watching TV and we'd have a light on and it would just turn off.
Yeah.
Randomly. Like, okay, mom's at it again.
Yeah.
But
it is a little freaky though. Like the couple of times that it happened, like in the middle of the night.
Yes, well, that's the last thing you want to wake up to at like 4 or 5 o'clock in the morning is your bedroom light on.
Yeah.
Out of nowhere.
Yeah.
So I did manage to get it fixed. I changed the names of some things so they weren't close to what we had and whatever. But it came up at assisted living because my mother was telling one of the CNAs who wanted to do this. And I warned her that my mother would sometimes turn lights on and off.
Yeah.
But I don't think she's going to have that problem.
Hopefully not.
So anyway, moving on to our episode. Assisted living facilities can cost anywhere from $3,000 to $10,000 per month or more.
Per month.
Out of your and your loved one's pocket. Obviously, they do a lot to keep our loved ones safe, but that's a lot of money. What if your loved one doesn't have the kind of savings that can make an expenditure like that possible? So for help on that, we are turning to a repeat guest here at Caregiving Gen X Style, Robin Hollar, who was a medical social worker. Robin, thanks for being on the show.
Hi. Hey, Steve. Hi, Jennifer. Thanks for having me.
Yep, we're happy to have you back, Robin. You were such a wealth of information on the previous show, which now has been...
It was about long-term or long-distance caregiving, and that was really, I think it was one of the first 5 or 6 episodes we ever did.
Yeah, so we definitely... I remember getting off that episode with you, Robin, and thinking, oh my gosh, like I wish we had known to ask Robin some of these questions, before we were in some of the situations we're in. But we know where you are now, Robin, and we found you again.
Yes, and a number of my friends reach out to me quite often, so I get it, and I'm learning every day something new.
Yeah.
So.
Oh, I bet. So the first time that we had you on the show, you were actually talking about long distance caregiving for your father. So he unfortunately passed away really just days after that show was recorded. So I know that we already said this to you off the air, but officially on the air, belated condolences to you for that.
Thank you. And yes, I am still a long distance caregiver and have stepped up my visits to see my mom quarterly. That's part of my new strategy. And, certainly my father had experienced a fall, and that led to fractures, that led to a domino effect of other medical conditions coming up. Mm-hmm. And ultimately that is what he passed from. And I think that's a number of the reasons why I get so many referrals from other adult caregivers about this topic is because things happen, accidents and chronic medical conditions, and people just want to explore all of their long-term options.
Yeah, I definitely think often you think about, as people get older, you at least I do, or used to, think about the big thing that might happen to take your loved one from you, right? Like a big illness like cancer or something like that. But in fact, I do think a lot of times it's something relatively simple or simple for like people our age. But when you get to be that age and something like that happens, as you said, sort of a domino effect of things that, cause issues and ultimately can lead to someone's death. So I'm so sorry that's what happened with your dad. So you said your mom, you're visiting her quarterly. Generally speaking, how is she doing?
She's had her share of health issues as well, and we just went through the whole insurance conversation. And in this case, we were talking about not prescription drug coverage, but we were talking about those auxiliary insurances. So what do you do with dental care, and what do you do with eye vision care? And, those are additional insurances that you have to buy separately. Where do you find them, and what's a good plan? So that's what we were exploring. Oh. I can appreciate it. But she's doing fairly well.
I've had talks with my mother about those same things, and she's on Medicare, but she likes to say, Medicare, they don't care if you can see, chew, or hear.
Correct.
They really just don't care.
And Medicare has changed greatly over the decades that I've been doing medical social work. There are tremendous changes with Medicare. And I get referrals about assisted livings because people want to know, does Medicare pay for it?
Okay. Yeah. So let's talk about, yeah, I mean, it's overwhelming. I speak from firsthand experience right now. I mean, just having gone through this change from one plan to another with my mom. And listen, again, like I know it's all going to be fine after the first of the year when things get streamlined, but it truly is overwhelming. So of course
it is.
You know, we've mentioned you're a medical social worker and you mentioned that you get referrals about assisted living. So let's talk about that. The first thing I would think people should look into if their loved one has to make a move to assisted living is, you know, how do they come up with the money? Like, I would imagine maybe the first place you would think to look is, you know, their home or, you know, any property or assets that they have. Is that a good place to start?
Yes. So that is a good place to start. Let me break it down for you pretty much the way I start with my families when I get a referral. Folks will call me and I conduct an intake. And all of my referrals come to me from doctor's offices and nurses that I'm working with. And the first thing they'll ask me is, what does Medicare pay for? And so I have to do a good bit of education for folks. And I explain and provide for them a quick overview, and then I do a deep dive, sort of bringing a person through all of the different options and exploring that a little more. And when someone tells me their home environment is that they're living at home, immediately I put that into a parking lot in the back of my head, and I start thinking about home as an asset. Mm-hmm. Home is, you know, a resource. And then I may even look at a person's insurance and talk with them because their insurance gives me some cues, if you will, about what are possible options. What I mean by that is if someone has Medicare and TRICARE, I know I can talk about another option for paying for assisted living, which are the Veterans Administration.
Okay.
If I see that someone has Medicare and Medicaid, I can make sure to talk with them about Medicaid insurance and Medicaid programs that are available to help pay for assisted livings. The final one that tends to cue me or give me, you know, like, oh, we're going to talk about this, is Medicare and Blue Cross Federal Insurance. If I hear someone has worked in industries related to the government, defense contractors, I'm up in the Virginia, Maryland area, and so there's many, many individuals who have retired from the government.
Sure.
I will ask them, did your parents enroll in long-term care insurance? So that is the overview, and then caregiver and I will go into a much deeper dive in those areas. Private pay is truthfully very hard for families to pay. The room and board, as you said, is quite high. It has gone up exponentially. I have been in this role for 5 years, and I have lived in many different states. And at this time, I have fewer and fewer low-cost assisted livings to refer to. I can find an assisted living with a shared bedroom for around $1,900 a month.
Okay.
Yeah, and I've done some research, and I think that's about what I'm seeing as well. You know, $2,000 to $2,500. But let's back up a little bit. I guess.
Right.
You know, we've said over and over on this podcast, insurance does not cover the cost of assisted living. But if you're on Medicaid, or if your loved one is on Medicaid, there are some state programs that you can look into, things like grants and whatnot. How does that work?
Right. So that plays into what does your state offer? And your number one resource will be the Office on Aging. And if someone has a lower income, the Medicaid income that Jennifer was referencing tends to be around $1,000
Yeah, it's definitely it's under 2,000 a month. If I know what you're referencing, yeah, it's like around
1,200. It's 1,200 a month to the Maryland QMB, qualified Medicare beneficiary.
Yep.
That's insurance. Okay, so 1,200 a month is not going to get you too far with all of these cost of living expenses. But over through the Office on Aging, you can speak with someone about the Medicaid waiver programs, and that is the service line that you're referring to. Each state offers very similar services for these waiver programs for the older adults and disabled. Predominantly, when you have an intake, it's going to be to determine is your loved one meeting criteria for needing assistance with more of their activities of daily living. And then the second criteria will be, do they meet financial criteria? And many times you still have to have very low assets, meaning around $2,000 here in Maryland to get on the waiver programs. There's wait lists. I typically tell people get started early. A number of the assisted livings, you have to find the assisted livings that will accept the Medicaid insurance waiver.
And I think one thing that you were mentioning, I think this is sort of what we had to do with my mom too. So we had a whole thing, squirrel for just a moment. Shockingly, she was not under full Medicaid coverage. She was under partial, and we couldn't figure out why. And I'm not going to say specifically what her income is, but let's just say it 100% was, within the qualifying amount. And we did learn out there, I think a couple years ago, actually, like post-pandemic, there was like a whole glitch in the system, and like some things got all mixed up, and people who should have been on full Medicaid were not. And so we sort of had to like reapply for my mom. So number one, I feel certain we missed out on a couple of years where for sure she could have gotten, more benefits, more things available to her. But one of the things that we did, and thankfully we did it before she left a skilled nursing facility, but the screening, and I think that's what you're referencing, Robin, like, right? They sort of looked at her like day-to-day ability and what could she do on her own and not do on her own, and then would she qualify for some services in the home, right?
Yeah, that is often, so home and community-based Medicaid waivers exist in every state. And I can send you all a link to sort of provide an overview to all the states.
Yeah.
Okay, yeah, we'll definitely put that in the show notes for sure.
Yeah. And what they're all about is supportive services in the home. Typically, I tell families it's about providing some extra help in the home to you. Mm-hmm. It does not always lead to coverage for an assisted living, but that is on the spectrum of services that the state will consider. Everything has to be run through a supports planner, an individual assigned to you to review your options, to draw up a care plan, and it's submitted to the state. I have flat out advocated for some of my patients to get assisted living support, and I'm still waiting.
Oh my gosh.
Wow.
On some of them. The home and community-based waiver is meant to be an option to the state having to support so many individuals living in nursing homes.
Right.
So it is far more cost-effective to send out an aide to the home and provide a backup to the caregiver. There are assisted livings who I've worked with who have told me, yes, they work with the state, they accept a waiver, and they maybe have a few residents in their home. So I know it's out there.
Right.
But yes, it's an assessment done by typically the Office on Aging, sometimes by the Department of Health, and they're going to review what that individual's activities of daily living are, because an assisted living is there to help people with like their transfers in and out of a chair, in and out of a bed, not meal preparation, but more so, do you need help eating or being fed? It's medication monitoring and giving of the medications. So it is a far more, many times our caregivers, the less they live their house, that tells me the more hands-on they're getting. And I have some patients who literally are bedbound.
Sure.
I hope that answers, that's one type of program that I refer to as Medicaid insurance programs.
Yeah.
And in Maryland, we also offer an assisted living subsidy, and that is like a monthly assistance
Okay.
to help with the cost. And for us, it's up to $1,000.
Okay.
And you already have to be living in an assisted living. And it has to be a subsidy-approved assisted living facility. And in Maryland, the income criteria is $2,904. I wrote that down.
Okay. Okay.
So it's not going to cover the entire room and board. It's there to help with some of the extraneous costs.
And, I do know in Virginia, we have something very similar. I've looked it up a little bit, and there is in our area, there is one assisted living facility that accepts it. And I believe it's the same situation as Maryland in that they said, you have to be living here first and then apply for it. And, if God forbid you don't get it, then what do you do?
Yeah, that just makes no sense to me. It's so frustrating. Like, if we could afford, so I'll talk about my mom, right? If we could afford that, then we wouldn't necessarily need to apply for the assistance. It's like, which comes first, the chicken or the egg? Yeah, that's very, very frustrating. I do want to say something before we move on to the next question. You mentioned the office area
agency on aging.
Yes, that I can never remember like exactly. However, what I can remember about it is somewhere along the way during my mom's summertime stay at a hospital and then skilled nursing facility, I did get hooked up with our local, area office. And man, I cannot say enough nice things about the person that I got connected with.
Nice folks.
Oh my gosh. I 100% hit a point. I remember sitting in the parking lot one day, leaving the skilled nursing facility, and was overwhelmed. We were getting close to probably them discharging my mom, but feeling like she wasn't quite ready for it, and just having panic moments, and calling my brother that day and having all these panic moments about all this stuff. But just like sort of breaking down in the car. And then I get connected with this person, and she was just fabulous. She was calm. She was competent. She was friendly. She followed up. And let me tell you what, this is now months ago at this point. She just sent me an email about a week ago, just checking in. Hey, Jennifer, I just want to check in. Did you get all the plans aligned for your mom? Are you good on the Medicaid stuff? Is everything all squared away? I could not believe that. It was amazing. So for anybody out there, I don't care what state you're in, that is just an amazing resource. Don't forget about it if you find yourself in this kind of situation.
No, that's terrific. That is absolutely terrific. And I do think, there are so many resources available, but they're very hard to find.
Yes.
And our caregivers, that's my number one job, is to help narrow down that hunt. If this, then that. That's my thinking constantly for people. If you need this, then I'm going to send you here.
Right.
I'm always thinking 2 people in the household. I typically deal with multiple generations. I tend to deal with 2 elderly parents taking care of a disabled adult child. That complexity and you need someone to talk to. So a resource that you can also think of, say you've been touring all these super expensive Taj Mahals with bowling alleys, you may want to reach out to a senior care advisor. There are many companies. Some are privately owned, one person. You have maybe some people through national companies, and they are franchises. These tend to be very dedicated individuals who have had other lines of work in the geriatric population, and they've decided to branch out. And what I refer to them as is like a real estate agent for assisted livings. And they're really going to know their backyard. And they're going to be able to direct you and narrow down your hunt, your search to more precisely your budget and your geographic area.
Right. And we did actually use one of these for my mother's most recent search when she moved from one assisted living to another. One piece of advice, and I've said this on the podcast before, if you can find that one that is based locally and not a franchise, I tend to think they're better, because I've heard stories about some of these franchises, and I'm sure some of them are very, very good, but some of them, they don't necessarily have the proper training to actually find you, and they don't have the information of the entire area. So be real careful, talk to a few people. If there is one locally, purely based locally, I would say it's better to go with that.
I agree. And I refer out to a variety. I tend to spread the wealth around. And because people just really need to have that information. So you're not paying for their services up front. It's they are paid by the source. So if mom moves into the Jones Smith assisted living, the Jones Smith assisted living will pay them.
Right. They get a commission.
Another option, real quick about the home to consider, is a reverse mortgage. I have actually run across in my 5 years more and more seniors who are looking at that option, mainly because they do not wish to move out of their home. And this allows them to have some sort of cash payment.
Something you just said too, Robin, brought this question to my mind. If there's a caregiver, I feel like I heard somewhere along the way that there are some programs that might pay the caregiver a certain amount. I don't know if it's so how does that work? Do you have to live with the person, or how does that work?
So here in Maryland, the home and community-based Medicaid waiver will pay the caregiver if the caregiver says already, I'm doing the hands-on care, and basically instead of sending in an outside agency to be a personal care aide coming to the home for 20 hours a week, they'll pay the family member.
Okay. So how do you prove, what's the documentation you need if someone finds themselves in that situation? How does that work?
Oh, that's a good question. Well, basically, remember, in Maryland, everyone's assigned to a supports planner. And the supports planner then has the time to sit down and explain all of the state rules. And typically there is a clocking system so that the person has to clock in, clock out, to get paid by the state.
Wow.
So it is happening here in Maryland. The downside of that is if, the caregiver still doesn't get a break. There's no outside agency coming in to provide a relief or just time away.
No, that's actually a great point, right? They're getting some monetary compensation, which potentially could be helpful, especially if they're having to take time away from work or whatever. But right, as we've talked about on other episodes of our podcast, the being able to step away and get a break is so important. And that is not what this particular program solves. So that's actually something really interesting to consider.
Right.
Yeah.
And I will say the majority of my caregivers they're not working, they're at home. So when they sign up for this program, they're already in it.
Right.
They're fully invested. So one of the other things I had quickly mentioned was long-term care insurance and VA benefits.
Okay, so let's start out with VA benefits. Yeah. What are the benefits for veterans and their spouses?
Basically, if I get asked questions every week, and I try and find out if someone's been a service member, what branch, how many years. The benefit that ties over into support for assistance in the home or helping to pay towards an assisted living is a program called the VA Aid and Attendance. Have you heard of that one?
I've never heard of that.
I believe you actually mentioned this when we had you on last time.
Oh, really? I don't recall that at all.
I believe this came up somehow.
Well, then, Robin, by the way, you'll have to forgive me that I don't remember that because that sounds like a new term to me.
Yeah, and it's not as well known, but for my veterans to access the Aid and Attendance program, which basically is bumping up their monthly pension check, you have to be eligible for basic pension benefits, first off. So you have to start that. For some of my folks, those adult children find out their parents have never really engaged with the VA that much. Mm-hmm. Or it may be a surviving spouse. It may be a divorced spouse. I have a lot of divorced older adults who are now saying, I need to explore all of my options. So there has been expanded language, and it does cover divorced spouses, as long as the service member did not remarry. So you have to, you have to sort of really take the time and first off find out if your loved one is eligible.
Yeah, how would you go about doing that? How would you go about doing that?
Well, every single VA will have a way to reach out and to sort of explore your benefits options. And what I do is I typically will send a list of folks of all the sites around Maryland where they can reach out and talk to a benefits counselor, and just explore, what they are eligible for. And then, of course, you have to, if you find out, someone is eligible for a pension, you have that paperwork that needs to be completed. Typically, I will ask folks what amount of time they spent in the military. Did they have an honorable discharge? Did they serve during a period of wartime? I'll prepare them by saying these are the things you may want to start gathering a little history, gathering some dates, and go with your father or mother to the VA and start the investigation begins. Where were they? How long were they in the military? Were they serving during a wartime? And the reason is that the benefits mean you can maybe have more help in the home through a private duty company. You have benefits that help pay towards an assisted living. And I have found a few agencies that are just catering towards the military because it's a veteran themselves.
So just curiously, so if you have in the situation of you've got a divorced elderly couple, and let's even say maybe the person who served in the military is no longer living. Is that still an option? You could still.
Yeah,
okay.
I would explore it. I'll have to research it again for you, no problem. But I would say we need to be exploring all these options. We have people living much, much longer.
Yeah.
I have more divorced women who are going back to the Social Security Administration and seeing if they're eligible for their former spouse's benefits, even a portion, because cost of living is just driving people to look for any new income sources possible.
Sure.
But there's a part of me that says yes. If someone is living, the divorced service member is still alive, then the divorced person needs to apply, to seek out those benefits as you can. Boy, that was difficult to say.
I get what you're saying, though. I think in general, though, really the takeaway from this piece of the conversation, because I feel like we could talk about this for a really long time, to really think through all of these things. And I guess, right, worst case scenario, just ask. And maybe it might seem like a ridiculous thing, because I remember the first time hearing about, you have a divorced couple, but maybe the mom could still be eligible for the dad's Social Security benefits or some portion of it. And right. I'm not getting that exactly right. I know that.
No, but you're right.
Okay. So right. I remember hearing that years ago, and I was like, what? That seems kind of crazy to me, but also awesome for a whole bunch of different reasons. But who knew?
And that is the scenario that I live in, is that people get Social Security benefits from their parent because they are disabled. I have, someone loses a parent and they have survivor benefits. And so perhaps the VA can offer my patient medications for no cost, which then gives them more flexibility in their monthly budget.
Right.
And they're able to use that money for something else. They may not be eligible for a pension and therefore aid in attendance, but you know what? They can get some other benefit. And they also can still get other resources for assistance in the home and home health. So I really do try to encourage people to explore everything, and my favorite phrase is, let's cut the onion a different way and see what other circle of resources we can explore.
I love that. That's great.
So let's move on, though. You mentioned earlier long-term care policies, and this is a funny one because I just recently learned that there is a long-term care policy in my mother's name that came from my father's retirement. We were very excited for a few minutes because we thought it might help with the cost of her assisted living, but once I investigated, it doesn't. But some of our loved ones do have policies that have been laying around for decades like that.
Yeah.
Maybe as part of a retirement package. So can they help sometimes?
Oh my goodness, yes. They certainly can help. I've had multiple experiences over the past 5 years where I found long-term care insurance was helpful, but to get it activated was a challenge for the spouse, and the documentation required. There's hoops to jump through.
Sure. Always.
Always.
Yes. And that's the frustrating downside of this. But yes, I've had many times the policies that I've talked with typically a spouse about was a plan that would, have 100 days up front of skilled care necessary. And so usually that could include home health. You have a nurse visiting the home, patient needs physical therapy, occupational therapy, they're needing more assistance. And that could start the documentation train, if you will. And to move into an assisted living for memory care at $5,000-$6,000 a month, that significantly helped my one patient. The spouse, unfortunately, he had Lewy body, Parkinson's disease, and his dementia was quite profound, and he was falling all the time. So she said that was just a godsend to have that available. But what it will cover, you really have to get in there and read the underwriting. That's that little tiny print.
Yeah.
And unfortunately, they do a lot of slow down techniques too. I have heard caregivers say, I'm trying to get a copy of it. And, I also need the paperwork that they want. And they're going to mail it to me. They won't email it. So that's a slowdown.
Sure, especially now.
You'll hear yeah. You'll say, "Oh, we want a copy of the power of attorney. We need this." There's a lot of time delay, and documentation from the assisted livings. To an insurance policy will ask for very specific documents signed by specific people within that facility, and there can be denials. I had to help one caregiver track down an attorney to address what was being done in the denials.
Oh, my goodness.
So there's a lot of not as many long-term care policies out there as before, and some did close down because the market just got very challenging. They weren't seeing, I think they were having to pay out a lot more than they had brought in benefits.
Sure, yeah, which I think is often the case in the insurance industry in general, I suppose. One final thing that I just want to be sure that we cover tonight, and that is if assisted living, just is not possible financially, if you have to look into more of a nursing home atmosphere, they don't tend to be as nice as an assisted living facility, but Medicaid may take care of a large portion of the cost. So what are your thoughts on that? And I'll this is coming from a very personal place for me, and Steve and I have talked about this many times on this podcast. His mother is in a very different financial situation from my mom, and so as a result, my brother and I we say this all the time. Our goal is to keep her living independently, safely, of course, but independently as long as possible, because when there comes a time, maybe, where she can't live independently, it feels like we definitely, I know for sure we don't have as many choices available to us, but more concerning than that is it feels like we don't have any good choices available to us. Mm-hmm. So just kind of curious about your thoughts on that, and what Medicaid, covers and what you should be looking for at that point.
That's another conversation I have because I have so many families who cannot afford an assisted living. So we mainly talk about layering up care in the home, like you're doing right now, Jennifer, with the home-based community waiver programs that can address safety, if they'll cover, a lifeline and aides in the home to check on her, and you're doing the pill boxes, and maybe Meals on Wheels can help. But we also talk a good bit. For me, it's harder to place someone from the community out of the home into a nursing home. And the reason is that nursing homes tend to reserve their Medicaid beds for individuals who are not progressing with their therapy while they are under Medicare, while under the Medicare benefits. So I tend to do an education and prepare my families to be thinking about nursing homes by talking to their friends, talking to pastors about places that families or other loved ones have been, and perhaps touring them. Being prepared for those locations down the road, because we're oftentimes caught in a crisis moment. What I mean by preparing is by talking to other other individuals about the community and the nursing homes. You can get a sense of the reputation. You can also look at Medicare.gov for the scores. There are inspections done on all of these facilities as well as hospitals. And so you can look at the star rating and see what the scores are and some of the issues that are going on within the nursing homes. I will say yes to access getting into a nursing home. I prepare families for a medical emergency to go through the ER and, an inpatient stay. Does a person qualify for rehab? And moving into a nursing home, typically you have some coverage from Medicare for a few days, and then you need to talk with the social worker and the business management office about nursing home Medicaid, or called long-term care Medicaid. I say that like it sounds easy, but it isn't.
It's not.
It isn't. Mainly what you're asking is how do I prepare for long-term care Medicaid? Many times the Medicaid application you've already done for home and community-based Medicaid waiver is the same Medicaid application.
Okay.
For long-term care.
Right.
It is in Maryland.
Okay.
It is in Maryland. And the same amount of information is being gathered. So if she's approved for home-based Medicaid and goes into a nursing home, then the business manager would be able to verify some things with you, gather a little updated financial information, and pull the lever to transition the Medicaid over.
Okay. Yeah, no, that's good to know. And yeah, to your point, I think you touched on this briefly, just, starting to have the conversation early. And I know Steve and I have talked about this in some other episodes. And, that's 100% what we would say to anyone listening is, when you're not in the crisis moment is when you should be trying to explore some of these options. Now, I will say also from the firsthand experience, you get through the crisis moment, whatever that might be at the time. And when I know my brother and I, we've been in the crisis moment and we've been like, okay, it's time for us to start touring some places so that we just have all this stuff in our back pocket. And we both agree on it. And then we get out of the crisis mode and we get, mom's back home and she's doing great like she has been. I'm knocking on wood, our dining room table right now, like she has been for a long time now. And I will be the first to admit, we just kind of set it aside. And we don't set it aside because we're too busy to do it. My brother and I are never too busy to do anything related to my mom, but also just, you kind of don't want to think about it when you're not in the middle of the crisis moment.
Right. So you may find out that there's some lovely long-term care facilities around the community. For example, for me in Georgia, Presbyterian Village would pop up constantly. People would talk about it. It also provided skilled nursing care. So guess what? Folks wanted to go there for rehab. And they had a very nice long-term care wing. So you can get her name on a wait list. That's an option. So if things are sort of declining, the health is deteriorating, placing a loved one on a wait list is doable.
That's a good idea. Okay. Yeah, that's a good idea too, is even just thinking ahead. And it doesn't mean that just because their name comes up that you have to take it, right? I mean, you just move a slot down the list.
Well, and that's actually a good point with assisted living as well. And I know one of the places that we had looked at for my mother, they've constantly got a waiting list. And I toured the place, wasn't really sure it was the right thing for my mother, but I know they went ahead and put my mother on the list anyway, and recently called and said, "We've got a slot open." I said, "That's great. She found someplace else. Take us off the list." But you can do that with assisted living as well, and they're more than happy to, if you're not ready, just move on to the next person.
Correct. Yes. So, be thinking about doing that. In Georgia, I often was discharging patients out from my orthopedic floor at Wellstar, and people were, they'd say, "We just don't have the money for an assisted living." And I would talk about these state programs, but sometimes there aren't that many options for families. And so when you're caught in that in between, I'm basically trying to help families avoid as much of the crises experience as possible by helping them to anticipate these other things. All right, where can you place someone on a wait list? What do you do if someone's really becoming altered mental status and sick? This is how we get into the hospital and prepare for that hospital stay, and we're going to really try and move into a nursing home level of care at that point.
Right.
It's just the choices are less, but we still have our choice, and there are choices that can be made ahead of time.
All right. That seems like a good place to wrap things up. Robin, thanks so much for being on the show with us. It's your second time. Can we ask you back for a third time someday?
You bet.
Yeah, and Robin, I have to say this too, like just listening to you talk, like you just, and of course I think we mentioned this the first time, we know you outside of this world. That's how we came to invite you on here in the first place. But like just your voice and the way that you talk and your calm demeanor, I can only imagine that the families you work with are so fortunate. I feel like you have this very like steadying presence and calm demeanor, and I'm sure that goes a long way with your families. So just wanted to say that.
Thank you for that compliment. Thank you. Thanks. Thank you for this opportunity.
And thanks to everyone for listening to this episode. As always, if you want to get in touch with us, question, comment, inquiry about whatever, you can email us at caregivinggenxstyle@gmail.com. You can send us a text or a voicemail, 804-723-1221. You can find us on Twitter at Gen X Caregiving. We're also on Blue Sky, same handle, at Gen X Caregiving. And if you want to find us on Facebook, that's where we post the most. If you want to see stuff in between episodes, that's the place to go. Go into the show notes, find a link, click on the link. You'll take you right there and like it, and you'll get all the in-between stuff. We hope to hear from you soon. Have a great day.
Good night, everyone.